is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey, beautiful soul. It's Jacqueline from the Lost Labia Chronicles in partnership with Lichen Sclerosus Support Network. If you are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to our channel and please keep on watching. And if you have a friend or family member with lichen sclerosus and you want to learn more about the physical and mental health aspects of living with lichen sclerosus so that you can better support them in their journey, then please subscribe to this channel and please share it with them as well. All right, so in today's video, I am joined by the brilliant Ashlie Crewe, and we are going to be talking about clitoral myofascial release. Specifically, we are going to talk about how this technique can help break up clitoral scarring and also how it can potentially help to unfuse the clitoris. Now, many of us with lichen sclerosus do experience clitoral fusing to some degree or other, and I know that folks are going to be really excited about the idea of potentially unfusing without needing to go the surgical route. Before we jump into that, though, be sure to grab your tickets for the 2023 Lichen Sclerosus Support Network's Holistic Healing Summit. This summit is going to be bigger and better than ever. We have an amazing lineup of speakers and topics. If you want more details and you want the link to grab your tickets, just go to the description box below. As always, if you find the information in this video helpful, then please give us a like, please subscribe to our channel, and let's jump into things. So, Ashlie, welcome. I'm so excited to have you here with us today. Thank you for joining us.
Yes, thank you so much for the invitation. I'm always happy to talk more in this space. So, thanks.
I love that. I'm so excited. I've heard you speak at a number of occasions now, and I'm just so humbled to be here and to learn from you because you're just such a fountain of knowledge. And for the viewers, you're in for such a treat. Okay, Ashlie is so full of information and knowledge. She did her bachelor's in psychology. She's got her doctorate in pelvic floor physical therapy. She's done a number of courses and trainings on neuroscience and pain, developed multiple pelvic health programs for different clinics. She works with patients with pelvic health issues of all genders, and she's also a Holistic Healing Summit speaker and does a lot of collaborative work with Lichen Sclerosus Support Network, and we are so grateful to you. So I'm thinking before we kind of jump into like clitoral myofascial release, I'd love to hear a little bit about your background and kind of like what motivated you to come into the pelvic health space. Like what was the jump from psychology, I guess, to, pelvic health?
Yeah. So there's no short way to tell this story, but I tried to keep it brief. So I always sort of knew I wanted to be a physical therapist. I wanted to help people. But I also, when we had to sort of choose our undergraduate majors, the program I went to had like you could choose biology or chemistry or nutrition or nursing, a couple other things. And then psychology was in there. And I was like, oh, that sounds cool. And I remember at the time, the people who I was going to undergrad with were like, why psych? Why not bio? Why not athletic training or whatever? And I just kind of said, well, like, I don't know. Like, I'm going to be working with people. And so I don't think dissecting a shark in bio 2 is really going to help me work with people.
Yeah.
And so I said, but I think understanding motivation and being able to like pick up on nonverbal cues and all these things might help me be better. And so there was that sort of background. And then as I went through PT school, I didn't know like what specialty I wanted to do, but I had done my research project on urinary incontinence, which is like the most commonly things got just like researched in the pelvic health world. And I was like, well, that's interesting. Like, it's just not something that we in the PT world commonly think about. At least for me at the time, that was, many, many moons ago. And so whenever I started like working with my company or I started interviewing with my company and they said, what do you want to specialize in? And I said, well, this whole pelvic health thing is interesting. I don't know anything about it. But it's other than it works for urinary incontinence. So cool. And my company was like, well, there's nobody doing it in our area. So if you want to learn and you want to do it, we will support you in doing that. Right. And so for me, I went to this first course. It was a little introductory 3-day course and just kind of blew my mind. And I think at the same time, I had gone to a pain neuroscience course right before that also had blown my mind, right? So I went to this pelvic health course, was like, this is so cool. I'm going to help all these people. But it was also a very introductory level course.
Mm-hmm.
And then the very first patient who walked through my door for a pelvic floor anything was a woman who was having significant pain with intercourse and had not had penetrative sex in 7 years before she came to see me. And I remember like doing her, talking to her that first visit and thinking, I'm a baby pelvic PT. I'm not ready. Like, you need somebody so much better. Like, you need somebody so much smarter, with so much more training. Like, and God bless this woman. I will never forget her. Where she said, Ashlie, but you're it. Like, there's nobody else. She said, I have to drive an hour and a half anywhere before there's anyone. And she goes, even my physician doesn't know why I have pain. So she's like, you sound like you know. And I was like, okay. And so, I mean, it was a really lovely experience where I was very honest with my education and where I was at, and she just accepted that. But it was also really great for me as a newbie physical therapist and brand new baby pelvic PT, where, because I was so worried that I was going to mess it up, I would like explain to her like my reasoning behind like, well, if it was your hamstring muscle, I'd be doing this for it. And so I'm going to apply those principles. Please don't sue me. It was kind of like my, like, I don't 100% know if what I'm doing is right, but this is the why I think, and she was great. Right. And so I think the day that she came back to me and said, you've saved my marriage. I had sex with my husband last night. It did not hurt at all. With a bouquet of flowers and a bag of M&Ms, because I told her I love M&Ms.
Stop. Oh my gosh, I love that.
And I was just like, this is the coolest job ever. To be able to make that kind of an impact in someone's life. Like, that was it for me. Hook, line, and sinker. Like that, I'm going to be a pelvic PT. And I think for me, like then early on, because that patient of mine was related to a local OBGYN. And so that OBGYN just started sending me all of the patients with sexual pain and sexual dysfunction, right? So it was like a baptism by fire. I was like, no.
Yeah.
I wasn't qualified to treat her. And now I have a whole caseload. But I think like it was such a great way for me to experience, number one, like I had to get good and I had to get good fast. 2, I had to lean really heavily on my psychological background and training. But I think the biggest thing for it was to watch folks reclaim that part of themselves. And like one of my favorite patients, she was in her 60s when I saw her. And she said, my husband and I, it's like we're teenagers again. And like we're experimenting and we're just exploring. And like, and to give somebody, I shouldn't say I'm not giving, I'm participating in empowering them, right? And helping them reclaim it. Like, that is just the coolest thing. And so like to watch people just sort of break down some of those psychological barriers and just work through that. And I mean, it's messy work, like figuratively, it's not usually physically messy. But like to sit there and be crying with patients and just sharing their story and being in that journey on the good days and the bad days. Like for me, that is like the soul, like, oh gosh, it just fills my cup. And so with that introduction, like I got this baptism by fire introduction, like, and appreciated so much like how sometimes the lows are pretty low, but like, man, the highs are really high. And it was like, this is the coolest job one could ever have. So at this point I have a little bit more training than one course. So
I mean, we all start somewhere, right?
Exactly. And it's funny now that I'm in the seat that I'm in where I'm teaching other pelvic therapists and they're like, oh, I'm not ready to treat that patient. I'm like, yes, you are.
Yes, you are. Yes, you are.
I'm here for you. I will coach you through it. But like, just yes, like we've got to give people those services. And sometimes you are the best person, even if you've only had one course, because, you're there and you're willing to work through it. Whereas I think sometimes more seasoned physical therapists maybe like aren't as open to new ideas. They kind of like, this is my pattern, whatever. So I try to tell people like, don't shy away from somebody if they've only had one course. It's more about, do they click with you? Can you connect with them? Are they willing to be in the trenches with you? Because that's the therapist you're going to do well with.
Yeah, no, I 100% agree. The first physical therapist I went to for lichen sclerosus and pain with sex, they always talk to you about your goals. And she was like, okay, so what are your goals? Like, what are you looking to get out of this? And I said, well, I have painful sex. I have lichen sclerosus. And she paused and said, what's that?
Right.
And at the time, I didn't know. So I was like, I don't know, but I treat it with this tube of steroids and it does things to me. Like, I didn't even know what to say. But here's why I stuck with her. Right after she said, I don't know, she said, I'm going to go home and I am going to do my research and I'm going to reach out to my pelvic floor PT network and I am going to find people that know what this is and I'm going to learn from them and all of that. And I said that in that moment, that's when I knew she was going to be my PT, because I value honesty and transparency. I don't need you coming in there acting like you're the god and you know everything. I want to know, are you willing to learn? Are you willing to grow with me as a person? So like that for me was what really clicked off in my head, you know. And I love your story. And as you were speaking, I was like, oh, of course the connection with psychology. And that makes so much sense. And again, talking about the importance of clicking with your pelvic floor PT. And that's one thing I found with pelvic floor PTs is I'm like, they give you a whole different kind of healthcare. They treat you like human beings. And often when I talk to people in the LS community, they say that their first good experience with a healthcare provider was with a PT.
That's because cry.
Yeah. And it's honestly so true. And I always tell people, I say, you know, you're going to have such a different experience. These people are going to look at you like humans. They're going to treat you like humans. And I think some doctors don't appreciate the value of that alone in somebody's healing, you know, is just seeing them where they are, acknowledging them, validating their feelings. And again, just before we kind of jump into things, one more thing that really screamed out to me with your story there was just how big of an impact you have. And I want to tell you, as a patient with lichen sclerosus, who also told their husband 3 months into getting married, we're never going to have sex again, the impact that you have on our lives is astronomical. It really, really is. Like, not being able to have sex for some people sounds like so trivial. This completely breaks us. In every way possible. And sometimes it breaks our relationships. And it's like the impact that you have on our lives, like, just thank you. And I'm so grateful that you had this baptism by fire and you are now in this mentoring position. Like, I love this. So thank you. And so grateful for you.
So flattering. Thank you. I'm going to try really hard not to cry.
Cry away. Okay. We welcome all emotions in this space.
Thank you.
All right. So moving into some less maybe emotional stuff, we're going to talk about some of the changes that can occur with lichen sclerosus. And one of these things are what we call architectural changes. I have a full blog post on all the different types, which I'll leave linked in the description box below. But for today, we're going to be focusing on clitoral phimosis, which is really just a medical term for clitoral fusing. So for folks that are maybe like new to our channel, not too sure what this is, the clitoris, you can see it externally. It's also internal, but we're going to focus on the external parts. So here, this in navy blue is the clitoral hood. And then underneath it, you have this pink little bulb thing, which is your clitoral gland. So these are two separate parts. And in healthy tissue, we can kind of retract to expose the gland, and there's mobility. Now, what can happen with lichen sclerosus is that this hood can partially or completely scar over this gland so that when you try to retract, nothing happens. There's little to no movement and you can't visualize the glands, or maybe you can, but not a lot. And this causes us a lot of distress. Not only the distress about like body dysmorphia that can come with that, but this can also cause pain. It can cause like tightness and pulling. You can get keratin pearls, which I talk about in that blog post. Very, very painful. And it can also cause reduced sensation. Again, very, very distressing for many people in our community. This is like one of the top 3 concerns. And for the longest time, we were told that if you have clitoral scarring, clitoral fusing, your only option is a surgical procedure called lysis of adhesions. Now, this procedure you get put under, it involves duct probes and medical scissors, and it is an actual surgery. But a lot of people are like, oof, that's really scary. Like, the clitoris is a really important organ for us. And if they make one wrong move, you could lose sensation for life. So that's really, really scary. And again, for the longest time, that seemed to be the only option that we had. So now we're starting to hear more about non-surgical options to help release some of those adhesions and to free up that clitoral glands from the hood so that we can retract again. And one of those techniques is called clitoral myofascial release. So that's a big mouthful, right? Clitoral myofascial release. What the heck is that? So, Ashlie, maybe first, what is myofascial release? And then how is that applied to the clitoris in this kind of clitoral myofascial release?
Sure. Okay. So Latin, myo is muscle. Okay. So myofascial is looking at the connections between the muscles and what we refer to as fascia underneath them. I'm so sorry to the vegetarians and maybe new converts to vegetarianism after I talk about this. But the way I explain fascia to folks who don't know is if you think about chicken breasts and that white, filmy, shiny stuff that's over chicken breasts. Okay. So the chicken breast itself is the muscle. The white stuff that's kind of slidey all over it is fascia. Okay. There you go. It's the best example.
I didn't know that, to be perfectly honest.
Okay.
And I am vegan, but I've seen, my parents, prepare chicken, and I'm like, oh yeah,
that's
okay,
what that is.
I know what you're talking about.
And so in all throughout our body, in between muscles and skin, in between tissues, that fascia is everywhere throughout our body. And it serves to help like the surfaces of our body slide and glide within our bodies. Okay. So the idea of myofascial release is any technique that's aimed at impacting the muscles and the fascia as well, and trying to make things move better, make things move more, make stuck things unstuck. Because sometimes it is the skin itself, but sometimes it is, and probably more commonly, it is this myofascial structures, either the muscles or that fascial tissue, that is more stuck. And so think about, instead of being kind of white and filmy, things can get thick and sort of like more like glue as it's drying.
Right.
And so myofascial release is really meant to get those tissues moving a little bit better. Sometimes we talk about like breaking up adhesions, and that's what we're doing, right? We're just moving those tissues. And so, yes, there is that mechanical principle of we are like causing a stretch, but also because we are taking things that are sort of stuck together and helping them unstuck a little bit, it lets some fluid get in between those tissues. And so it helps promote some blood flow to those tissues, which is really important for things like lichens and any scar healing. It helps get some lovely blood and nutrients and the chemicals that we need to heal our bodies to kind of flood in there. So I tell my patients, it's kind of like changing the oil in your tissues. Like I'm trying to like create some space and create some fluid flushing in to just help things get hydrated and move and slide and glide a little bit better. So that is the principle of myofascial release in a nutshell, really.
Get stuck things unstuck.
That's what we're trying to do. Yes,
because with lichen sclerosus, right? I mean, the clitoris is stuck, so we want to get it unstuck. That's what so many of us want to do. So basically, we're applying those techniques to the clitoris then, to the clitoral tissues. So what does that look like when we're doing that?
So sure. I have my clitoris here. Okay. And so like, as you were saying, like this is the glands, the part that is visible, and all of this is sort of tucked up and inside the vulva here. Okay. And so I have found headbands work really well for this.
I see. I was like, I'm very intrigued what you're going to do with the headband. Okay. Got it.
Yes. I mean, if I'm really going crazy, like I can sit there and make a little vulva opening or a vaginal opening out of it. But today we're going to focus here. So if you think about my little clitoris in their little hat, their hood right here. Okay. Let me make sure I'm getting that right. There we go. Okay. A lot of times, as you said, this can kind of start to come down and drape over that glands and can really, instead of being pretty mobile, can sort of get stuck and adhered here. Right. And so for a lot of times for folks, what we look to see is there's symmetry in one side versus the other. So we might see like, maybe we can move back this side a little bit and the other side stays stuck. Okay. But in general, what we end up doing is using 1 or 2 fingers on that tissue. There we go. And just gently trying to retract it, but just to the point of restriction. And this is where sometimes it can be really hard to do to yourself because it can be really hard to visualize. Like if I'm working with a patient, like it is, I am this close.
You can see, you can
I am
really
right
see,
there, right? And so even if you're using a mirror with magnification, like it from a distance, it's still kind of far.
Totally.
And so, but what we're trying to do is gently retract that tissue, just the point where we start to see that tissue that's as far as it wants to go.
Right.
Some of the more barbaric treatments, if you will allow me to say that, for lichens has been like folks who just sort of forcefully retract to try to break up that scar tissue or those adhesions. I don't see that having a historically great track record of a success. And so that's really important where we say we want it to be sort of this very gradual pullback and then maybe just a hold, but I don't want it to be really super uncomfortable for my patients.
Right.
So I tell people like it should feel maybe a little bit of a stretch, but that's really as far as we want to take it. It shouldn't really be painful. And the really cool thing about it is there's a lot of different things that we can do there with it, because now if you'll let me use my headband as the hood and then the fascia connected to it, this clitoral hood, it really is connected to the fascia that goes up and into your abdominal wall, into the rest of your pelvis. So let me drape. Now I've got a pelvis. I've got a clitoris here. Let me see if it's going to work with all my things. There we go. So this, let me get set up here, is roughly the setup, okay, as far as clitoris on the pelvis. And then we've got my hood over the top of the clitoris, like so, okay? This is still connective tissue. This is still that fascia, and it really is continuous with stuff that goes down into the hips and stuff that goes up into the abdomen, okay? I mean, there's only so much I can juggle at one time. So
I was already impressed by that. So
thank you. This is not my first rodeo. It was all like when I ordered this clitoris, I was like, it needs to make sure that it fits relatively on my model.
Yeah, 100%.
So what I might end up doing when I'm working with a patient though, is maybe my fingers are down here and I'm working on mobilizing this tissue, just that point of stretch. But I've got my patient and they've got their hands on their lower abdominal wall, or maybe their inner thigh, and they're sort of tugging on this tissue as well. Because if the fascia is stuck here, it's stuck elsewhere as well. And so I only have two hands. And so I might have my patient, especially if that tissue is really sensitive, then I might tell my patient, first, I'm going to have you pull over here, and you can just pull on that tissue, kind of grip it and kind of pull up. And then while they do that, if that's still pretty comfortable, it's not really impacting this a ton yet, then I can be doing tiny little micro motions here at the clitoris and end up with a lovely, lovely fascial treatment. Then again, I think too, I don't love having my patients just kind of come here, lay down and let me treat you. Like I want you to be an active participant in this. And so to give you a little bit also of autonomy. And then if it becomes too much, that patient has the option of like, oh, I'm going to let this go and let this be a little bit more slack here because it's getting a little bit intense. But generally, when we do those sorts of treatments, we're trying to just improve that mobility of the clitoral hood, to help it uncover a little bit more. And in a really, it's a slow process as far as creating change. It's not a surgery that's going to be a one-time treatment and then you never have to come back, right? But I think what I love so much about it is that I think surgery has its time and its place, for sure. However, I'm a big believer in like, once you have had a surgery, like you've had a surgery and there's no going back. Those tissues are forever changed. And so I do not have LS, let me say that. So I can only speak from my lived experience. But I think for things that affect my body, I generally try to go to the most conservative route possible, unless the conservative route's not going to fix the thing, right? That's my bias. And I've got no problem if somebody's like, forget it, I just want the surgery. Go, heal. I will treat you. I will find you somebody, fine. But one of the things I really love about it is that when we think about the neuroscience behind all of this fun stuff, right? The nerves that give us sensory functions to those tissues live in the fascia. Like that's where nerves come from our nervous system and go to our tissues as they travel through that fascia. And so when we are impacting that fascia in this really graded way, where it's not super traumatic, it's meant to be a pretty gentle stimulus, it really helps improve our nervous system firing in that area as well, and helps our brain and body connection more so than being put to sleep, having things cut and removed.
Mm-hmm.
I find that so often some of those folks say, yes, now my clitoral hood moves, but I have so much pain still.
Right.
And I think it's because the nerves just didn't get the treatment that the nerves probably needed as well.
Mm-hmm.
And so I also think then too, like, yes, this more conservative approach is maybe more laborious, and that it does take repeated sessions, it does take repeated treatments. But I also think then too, I think patients become really familiar with their own body. And I think just going through some of that work really helps your nervous system. So, and then too, I kind of tell folks, even if you have the surgery, you still need to do some of this afterwards to keep
100%.
your new mobility.
Yeah.
And so again, I have no problem, go have the surgery, but find yourself a pelvic PT afterwards to help make sure that that doesn't adhere back down. Because one of the things we know about LS is it is an autoimmune condition. And so inflammation, any inflammation can make things worse. So worst case scenario would be like a surgery would send people into a flare and create more scar tissue. And so I'd go to a pelvic PT is the moral of the story.
And I'm on the same page as you. How I manage and have always dealt with my lichen sclerosus is like the least invasive, less risky stuff first, and then I move to the bigger stuff later if those more conservative measures didn't work out for me. In one sense, it kind of helped me because I live in Canada and they don't really do that surgery in Canada. So that wasn't really an option for me. So I kind of lived the first few years like, all right, well, there's no hope for me, because to me, it was like surgery or nothing back then. And then I started learning about this and it was like, oh, yay, this can happen in Canada too. Like, I don't need a surgeon for that. But I think at the end of the day, what is most important is that people have options. So it is your choice if you do the surgery. It is your choice if you do clitoral myofascial release. It's your choice if you don't want to do anything. And you're like, I don't care if it's scarred over. It doesn't cause me any issues. Like, your body, your choice. And so I think that's why I'm so excited to have these options, because now it gives patients,
choices.
It puts the controls back in their hands. It's like lichen sclerosus takes so much choice away from us. And so to be given some control back, I think can be really, really empowering. And I think with, surgery or clitoral myofascial release, it's also about thinking about the risks and the benefits and how that fits into your lifestyle. And, with surgery, it is a one and done in one sense. Like, you leave and it's unfused, but, it can take 6 to 8 weeks to recover. And then there is always the chance of that part refusing. So, there's that too. And then you're still going to end up working with a pelvic floor PT. So, there's just a lot of those things to think about. Like, maybe you need, with clitoral myofascial release, you need more treatment, but there's less pain, there's less recovery, there's less downtime, there's the benefits that you mentioned. So I always tell people, like, these are important decisions you're making about your health. Take your time, think through the risks, think through the benefits, and look at your lifestyle and see what makes sense for you too, right? Like, being in Canada, it was like, well, the surgery doesn't make sense to me because that would end up costing me $30,000 when all is said and done, for the flights, the hotels, the surgery, all of that. So it's always about risk and benefit, and really just informed decisions about your healthcare, I think, is what is so important. Yes. So with respect to clitoral myofascial release, is there ever an instance where you would tell a patient, like, no, we shouldn't do this on you, with lichen sclerosus specifically?
I would say, so if folks are experiencing, like, I'm thinking of one patient in particular I was seeing that she came in and had been working on over the weekend, like working on her tissues over the weekend, doing some of this on her own. And when she came in, some of the adhesions had actually broken and she was actively bleeding.
Okay.
And I was like, sis, we're not doing this today. Like, I'll work on your abdomen, I'll work on your thighs, like, I'll work around, but I need you and me to both hold off if those tissues are actively, like, broken up a little bit. And so, but truthfully, that's pretty much the only time. Because the lovely thing about it too is that it's not like it is a pill that you take. because we can dose the intensity, we can dose how hard we push, we can dose where we apply pressure. And so with that, even if like in her case, like I could not do it on her labia, on her clitoral hood that day, but I worked on inner thigh and I worked on, you know, her labia majora. And so with that, because it is so adaptable, there's not a whole lot of contraindications for it, other than we don't do it over skin that is not of good integrity. Otherwise,
makes
that's it.
Perfect sense. And that was kind of my intuition too, is that if there was any like open sores or wounds, whether it's from the adhesions breaking or just, you know, you have a fissure or a tear, like obviously if you have a tear on the clitoris, probably don't want to be pulling, even though it's gentle pull, it's not, you know, a more aggressive stretch, it's still you're pulling and there's an open wound. So as long as, like you said, the skin integrity is intact, then there's no reason for folks not to do it.
No.
All right, so the $1 million question that I know has no answer, but I'm going to ask it anyways because I know people want to know. It's the burning question. Everyone wants to know, how long until I see results? How often do I need to do this? What can I expect in that realm?
Great. Thank you for asking the question that has no answer.
And I know that, but
everybody, I get it because I hear it all the time. So I would rather put it out to the masses, and that way you can go to your therapist and say, well, I heard on this YouTube video, this is how long, right? Generally, I tell patients I expect to see some change in tissues. Some change in tissues. I'm choosing my words very carefully. Tissue mobility, tissue color, tissue, some change in tissues within, I'm going to even go the long game, 3 weeks. Like realistically, I actually want to be able to see something happening in 1 week. But that's me being this far away from your clitoris, like, right? And so, so generally I tell folks like 3 weeks is when I expect you to say something is happening. And it's not going to be, oh, I had full adhesion and now I have full retraction. I keep making the hood motion because whenever I teach,
you know,
I teach with this hood.
Oh my goodness.
And I say, I'm the clitoris and this is the clitoral hood. So that's that gesture that I keep doing.
That's a really big hood. It goes like past your,
I know.
Your chin.
This is the sweater awesome. That I teach with all the time because it's great for folks who have like LS, because I talk about how things can just encroach. Anyway, but I generally say like something should be changing within 3 weeks, as long as you're applying the topicals that you're supposed to be applying from your doctor, that you're coming to see me on a regularly frequent basis, and potentially doing some stuff at home with some guidance. So 3 weeks is what I'm going to say. You're going to start seeing something happen. The tough thing that everybody wants to know is how long till I'm done, right? And I think that's the even trickier thing to answer, because it is, I tell people it is like the stock market, like it's highs and lows. Right. Like some of the highs are high, some of the lows are low, like, but it generally tends to fluctuate. But the overall trend, if you stand back, is slowly and steady upwards. And so generally I see folks who have LS for about 3 months, I would say, depending on severity, obviously. But I would say that's coming to my clinic, doing some things at home, and that usually in about 3 months, depending on level of severity, they are at a point where either they are functional to the point where they don't need me to do any further work, or they're saying, I need a break from PT for our bandwidth, and I have enough that I can work on at home. Or we're just at a point where we're saying, okay, you know what to do. Go do. Like, you don't need to pay me money to come in and yell at you and tell you what to do. I don't yell at my patients typically.
I mean, like you said yell. I was like, come on, you don't yell.
No, I don't yell. But then I say, no. And then I'll say, like, you know, come back, let's set up an appointment for 3 months. If you have any concerns and want to come in sooner for me to check things or whatever, fine. But I think you have the skills to work through some things for the next 3 months, and then maybe we'll come back in. And then, so, but generally I would say by 3 months is a point where they're at a really functional point. And I think that also gives us plenty of time to like work through what does sexual activity look like. If even at the end of 3 months, receptive vaginal penetration with a penis isn't happening, they at least have the skill sets to work on how to get from wherever they are to there, if that's their goal. And then again, I'm always just a big believer in, I want to be a part of your journey. I want to be here to help you. Once you're mine forever. Like unless you don't want me, and that's fine. But I tell folks like, but you don't necessarily need to come and see me twice a week, every week, if you can treat yourself for this chunk of time, So generally I tell folks, like, I like to see folks more frequently. And I know this is where things get really sometimes dicey in the pelvic PT world, because a lot of pelvic PTs are cash based. And so that lots of folks are being charged.
What does cash based mean? I don't know if that's like an American thing. What is
probably an American thing. Sorry, I forget Canada. So lots of pelvic PTs in America are cash based, meaning you have to pay them cash. They do not accept insurance.
I see. Okay.
And with that, some of them charge.
Oh, wow. Okay.
A lot of, I mean, and I'm not saying that they're not worth it, by all means, but because they don't participate in with insurance, they see patients, and I have the Facebook posts there saying, oh, I charge $350 for a first time visit or $200 for a follow-up visit. And so for a lot of folks, doing that 2 or 3 times a week isn't super feasible.
Not sustainable. No.
Right. And so that's why I will always work for a place that accepts insurance, I feel like, unless something else goes crazy, because pelvic PT should be able to use your physical therapy benefits if you have that in your insurance plan, wherever you are in the world. And in lots of lovely places like Canada, it is just covered. So cash-based pelvic PTs aren't so much a thing. But so really with what we know about tissue change and what we know about your nervous system, if we want tissues and nerves to change, they need high frequency, low intensity change. And so instead of having you're going to come and see me once this week, and I'm going to potentially fairly aggressively mobilize those tissues. And then you're going to come back to me in 2 weeks because I'm asking you to pay me $300 every time you see me. And I'm going to aggressively mobilize those tissues again to try to give you the most bang for your buck. What we know about tissues and the nerves is that it's much, much, much better for me to treat them for maybe 10 minutes, 3 times a week,
right,
and give you other exercises and things like that to help, but not do really aggressive stuff. Because if I do aggressive stuff, I'm just causing an inflammatory response. And so generally, like when I see folks who have LS, like I'm very honest about all of that. And I say, like, I'm here to meet you where you are, right? If you've got the bandwidth to come and see me 3 times a week, like I will happily see you 3 times a week, and you will see results. I can't guarantee, but I can almost guarantee
right.
in 3 weeks, if you're going to PT 3 days a week, you're going to see tissue change.
Right.
If you say, Ashlie, I can't, I just have a lot going on, whatever, I don't have the bandwidth, I am here for that conversation. So I like to say, tell me what you can do, what's realistic for you. Because if you say, Ashlie, I can come like 1 day a week, I'm like, okay, then that's totally fine. I'm still here for you too. And you're still going to see improvements. Just instead of that 3 weeks, you might need to give me 4 or 5 before you can start to see change. And so I think like making it adaptable to the patient, because yes, like the medical professional in me, right, wants to be like, you get your butt to therapy 3 days a week and I'm going to treat you and you're going to get better. But I think also, and this is where my psychology stuff comes in, is like, I have to really be aware that like for some patients, coming to see me is trauma, or could be trauma, that they are seeing me and I am the living, breathing representation of what they might not love about themselves right now, and what they're struggling with. And if somebody doesn't have I don't ever want to be the source of your trauma. And so I tell folks, like, if you can come and see me once a week and be a happy and healthy and whole person, great. I will see you 1 time a week and I will do my damnedest to like make sure you get the best care humanly possible. I would rather you do that than force yourself to come and see me 3 days a week and cry on the way home. Like, nope, I don't want that for anyone. And so that's where sort of this balance of Ashlie, the medical professional, and Ashlie, the psychologically informed therapist, kind of come into play. And I say, what is realistic for you? Because I can sit there and say, this is what the science says. But I also know that if I talk you into doing this and then you go home and are crying because you saw me that day, that's going to just create more negative brain body connections, and I don't want that for you. So I really believe in like thinking about, if you're on this journey, what works for you, and and just being really honest and really gentle with yourself to say, what can I do? What makes me feel good at the end of the day? I had a patient who said she was coming in doing all of the things with LS and all of the holistic treatments, all of the medical treatments. And she was telling me, like, one of the things that she said she has to was like doing this journal for 20 minutes a day where she like wrote everything that she was feeling about her vulva, about her tissues, about her body, whatever. And then she said, and then I'm supposed to sit there and do like a loving kindness meditation. And I was like, okay, how do you feel after you're done with that? And she's like, I feel like shit. And I'm like, then maybe that's not a great treatment strategy for you. And she's like,
or it's not right now.
Right,
like
exactly.
It might have its place later, but it doesn't seem to be serving you in this moment.
Exactly. And so I think just being really open to that, you can hear what you're supposed to do. And I understand that a lot of the people who are putting that content out there are doing so from the perfect place, really, from a place of help and healing. But I also think, like, don't get up into your head about what I should do, because you need to sort of really be mindful and be thoughtful with yourself and what is the right thing for you to do right now. And it's okay if that changes. And so sometimes patients will be like, okay, I need a win. Like, so I'm going to see you 3 times a week until I see some tissue change. And then I might need to pull back and see you twice a week or whatever. Great. Like, and this is where I tell my patients, like, you are the only person who ever always gets to make decisions about that part of your body. Like, so you tell me what we're doing. I can give you the reason why I think that might be a good or not great idea, but you still get to decide. So I think it's just really important that you're just really honest with yourself and take that time to be thoughtful of, like, how am I feeling about this, and sort of help kind of choose your own adventure a little bit. Because I think, like, that's really what's going to contribute to your overall brain and body healing, is that journey of feeling your body and really being in tune with what's going on with it. So
I 100% agree with you on that. And, I really respect your approach a lot. I think when we have conversations about pelvic for PT, we do want to think about it, everyone always talks about like the biopsychosocial model, and it's like, let's also think about those social and socioeconomic factors that go into this, right? Like, PT straight up is not accessible for some people financially. Like, some people can't even do the assessment. They can't even get into the door. And then, other folks, it's like, I mean, I can, but now I'm really playing with my budget and tweaking some things. And, I can't afford to go 3 times a week. And it's like, that's an important thing to talk to your potential therapist about, so that they can work with you and find something that works. And again, that point about like re-traumatization, like, by the time people come to you, they probably have a lot of medical trauma, right? And sometimes you don't even realize it. Like, sometimes you think like, oh, I'm okay. And then you leave and you're just hit with all of the emotions. And it's like, it's so important for folks to also be mindful of their mental health throughout this journey, and to really respect where they're at, and then communicate those needs with you. Like, maybe I didn't know, and I started seeing you like 3 times a week, and after a few weeks I'm like burnt out, and I'm like, Ashlie, like, I don't know what's going on, but like my emotions, like, I can't handle it. And then we have a conversation like, okay, so where do we go from here? How much do we want to dial it back? And again, like you said, it's my decision or the patient's decision at the end of the day. So I love that you're all about the science, but also recognizing that these people are human, that these people have trauma, that these people come from different socioeconomic backgrounds, and we have to work with all of those to find what works best for the patient. So I really, really respect your approach, and thank you for giving the answer to the $1 million question that I know doesn't have an answer, because there's so many factors that go into healing and how people respond to different treatments. But I think it is nice to give people a general sense of what they might be looking for. So again, like, you could be like 3 weeks, like, holy crap, I'm out of here, Ashlie, like, we did it, high five. Or maybe it's 6 months. And, when I started working with dilators, one thing that I told myself was, it'll take the time that it takes.
Perfect.
I got rid of all the expectations, because having those expectations, like, I'm going to unfuse in 3 weeks, or I'm going to be able to have penetrative sex in 3 weeks. It's like, people don't always realize how much pressure, like, all that pressure on you, increases your stress, which drives up the nervous system, and then you're rushing through things. You might cause yourself more harm, and then that, just reinforces some of those neural pathways that we don't want to be reinforced. We're trying to create new ones, and so it's just like, when I started doing clitoral myofascial release and a couple other techniques, I was just like, I don't know how long I'm in this for, and that's okay.
Yes.
But again, I do think that sometimes it can help to just have a general-ish idea. And I know that folks do like to know, like, how long? So kind of wrapping up, I did want to ask, with respect to finding a PT, because I think that, and maybe you disagree, but I think ideally people at least want to get assessed. Like bare minimum, you want to get assessed before trying to do this on your own, if it's accessible and possible for you. The reason is that clitoral thymosis, clitoral scarring, it presents differently on different bodies. So I might have complete thymosis. Somebody else might have scarring that's really heavy on the right side, but their left side is quite mobile. So the way that I am going to be treated with clitoral myofascial release will be different from the other person because we each present differently. So in my opinion, at bare minimum, it's important to get an assessment to see where you're at and what you kind of need and what your treatment program will look like. So that said, I know for some folks, finding a PT is hard enough, but finding a PT that knows about this is a challenge. Do you have any recommendations for what folks can do if they're looking for a PT that can do clitoral myofascial release?
Yeah. And this is the challenge, I think.
Yeah.
Because I think there's some competition in the PT world these days. And so I would love to sit there and say that everyone in my profession is honest about their skill set and knowledge and training when they advertise things. I would love to be able to say that. Unfortunately, I cannot do that and tell the truth. And so I think that becomes a significant challenge, especially with something as, let's call sensitive, specialized as lichens. And so there are lots of folks who have on their websites that they are pelvic PTs, they provide pelvic health. That's not good enough, if you ask me, because that is not a protected term. And so, Jacqueline, you could go watch a YouTube video over the weekend and call yourself a pelvic health specialist.
That's terrifying.
Truly terrifying.
Absolutely terrifying.
And again, like, I can't imagine a world where I would do that and feel qualified to do a visual skin inspection of
you had all of the skills and you still had mega imposter syndrome and you're like, I am a baby PT. Like, so I can't imagine you'd watch a video on YouTube and be like,
I got this. Take
Yeah.
your pants off. Yeah. I can't, but I know that there are therapists who do that. And I don't mean to speak ill of anyone.
Right.
However, I think this is where it does take a little bit of work. I do think, like, you can find places. Pelvicrehab.com is a website that is from the Herman and Wallace Institute, who do pelvic health education. So they have a provider directory. So that's pelvicrehab.com. Now, let me be very clear, by that website, that is somebody who has taken one course from that company. And so if they're on there, that doesn't necessarily mean they are a pelvic health therapist, because they might be a pregnancy specialist. They might be something else, or they might be somebody who only treats people with penises or whatever, but at least it's a start. And so there, and then the other one that I really am a firm believer in is the International Pelvic Pain Society. And so that is a group of medical professionals of all different backgrounds. So I don't remember if you're finding their website. Good job on you. But there you go. The International Pelvic Pain Society. So they have a provider directory that is nutritionists and midwives and PTs and physicians and just a bunch of medical professionals. But I would say that group of individuals are pelvic pain specialists in whatever. And so if they don't already know, those are also the people who absolutely will look things up for you, and nerd out about it, quite frankly. But generally I would say if you go to those places, and you find a physical therapist who is listed on one of those places that is accessible to you, local to you, whatever works, I'm a firm believer in calling them up and having a conversation And this is where I will die on this cross. Like any medical professional worth their paycheck
Amen.
will have a phone conversation with you.
Amen.
Like, I understand I can't talk to you for an hour. Like, I do have other patients to see, but there's no reason why I can't take 5 minutes out of my day, 10 minutes out of my day, hear your story and say, yes, I can help you. Or no, I've got to punt to somebody else. Let me help you find someone. And if they aren't willing to do that, then they are not the medical professional for you and for many others. I will 100% say that, because I think I get really, really irritated when people say like, I'm too busy to answer emails like that. And I'm like, I might not get to it this hour.
Absolutely.
But I firmly believe in having a conversation. And to your point, just saying like, I'm not a real familiar with LS or whatever it might be, but you know, I will happily go and do some research as long as you are okay with me kind of fumbling and learning as I go. Great. But I think a long time ago, there was a really interesting article that was published that showed that, and I think I mentioned this to Kathy the other day, that showed that your relationship with your PT provider was more predictive of your positive outcome than that provider's education and training. Which I thought like just speaks to just that impact of the psychological care, and then just that willingness to go on that journey together as a team. And so like, I think that's really interesting. So I tell people like, even if you call and they say like, I am not the expert, but I will go and look on Facebook groups and I'll do my research and I will talk to whoever I can talk to, and I will try to be the expert for you. That's somebody who I'm going to go to. I would rather have that person than the person who kind of bluffs and says like, oh yeah. And like, they're like, oh, I think I saw a slide about that in one class like 2 years ago. Like, I don't want that person treating me if they think they're an expert after, 10 minutes of training. So, but yeah, so I would say like call. And I know as somebody who has shopped for medical professionals as well, like it is not a fun experience to like, let me call another one and interview them. Essentially, I understand that in itself is laborious, and I'm going to call it a pain in the ass. However, that is like that is an investment that is, you're going to get significant return on that investment when you find the person. And it's interesting when I think now, I have somebody, and I think to, your point, like somebody who comes to me and they say like, this is the first time I've ever like been in a medical professional building and not felt awful about myself or felt a little good about myself, or, and so they was like, can I just come to you for my pap smear too? Can I come to you for everything?
Honestly.
I'm like, it's not what I'm allowed to do. But I think again, like when you find that person, and as somebody who has had a chronic pain journey and found my person, it's like, whew, like that is to have that connection with that person and to know that I have that person in my corner, like it is worth it. And so, yes, it takes some time and energy, but the return on investment is significant. So I encourage everyone to do that.
Yeah, 100%. And thanks for those resources. And yeah, I always tell folks like, vet them, vet your PTs, vet your doctors, ask them the questions, give a little like an elevator pitch of your story. Like, I have lichen sclerosus, I have clitoral phimosis, I have painless sex, and these are my goals. And then list out your questions, right? And ask them. That's really the best way to get an idea about fit, but also if they're qualified, and hopefully rule out the people that are doing a YouTube video and then calling themselves a pelvic floor PT.
Right.
That is so horrifying.
Exactly.
I cannot with that.
Yeah.
Before we wrap things up, was there anything else on the topic of clitoral myofascial release that you wanted to say, but maybe didn't get a chance to?
So I think I mentioned it, but it bears repeating. I would say if that is a treatment that has been deemed appropriate for you, or you think that you need to have happen, I really just encourage you to really take a very mindful approach to it and remind yourself that some slight discomfort during and maybe for a few minutes after is okay, but it should not be painful. And any of y'all who saw me speak at the Holistic Healing Summit last year probably knows why. So I think it is really important. I think sometimes we have this mentality of like no pain, no gain. Like we've got to push through some discomfort. And that's not really an appropriate approach for so many conditions, LS included. And so that would just be my kind of word of like, yes, do those things. But if you are PT or you are using those tissues so much or interacting with those tissues so much that is causing lasting pain or increasing pain, something needs to change. And so that would be my only little thing about clitoral myofascial release. And then too, I would say, like, if at any point in time, like your therapist makes you uncomfortable, that's worth a conversation too. And
Yeah.
so I think sometimes like we've got to really, I, as a medical professional, always want my patients to feel safe and secure and happy and whole coming to see me. And I think a lot of times that happens. And then sometimes patients just say like, I just don't feel good either internally, or it felt like you bumped something and maybe you weren't supposed to bump that. Have a conversation. And if your therapist is anything other than like, shit, I'm sorry, like, let's work through this, like whatever. Like also like you don't need to go and experience medical professionals that don't make you feel good. So
100%. Beautiful message to end on. So if folks want to reach out to you or find you on social media, where can they go?
So the easiest way is, and the most professional way is probably actually on TikTok. And so my TikTok, you have there linked at the bottom. So my DMs are open. I haven't made a TikTok in a while, but I might borrow some of this YouTube video and put that on my TikTok.
Yeah, totally.
But yes, so feel free to DM me on there. I'm happy to help if you have any questions or concerns. That'll be the best way to reach out to me.
Awesome. Well, thank you so much again. This was an incredible conversation, and I know folks will have learned so much just like I did. So thank you so much for your time. Thank you for all that you do for the community. We appreciate you.
Thank you.
And that is it for this video. We will catch you in the next one.
All right. Thanks all.
Bye.
Bye.